Hello.
Okay.
Hello, this is Lois Romeo from the SHIP Office for Medicare. This is Transitioning to Medicare Part 1. The SHIP Office is the State Health Insurance Assistance Program, lovingly known as SHIP, and we're local help for Medicare. We're set up to be no cost, confidential, unbiased, all trained counselors. So we do everything from education to one-on-one counseling. We can help you with applications. We can look at your benefit program review, and we can help with problem resolution. You do set up the counseling by appointment. It's available to all Carroll County residents. It's also a program that's nationwide, but in case you have friends who are interested in having help from this program that live in other counties, this gives you the phone numbers you can share with them of where they can find our counterparts. So, just as an overview for Medicare, people tend to think of Medicare as health insurance for people that are over 65. It's also for people under 65 with certain disabilities and at any age with end-stage renal disease. Came about in 1965, and there are currently 63 million people on Medicare, and that number is supposed to grow to 80 million by 2030. 10,000 people enroll every day in Medicare. So, if you have trouble getting through to the central number, that should give you a pretty good idea why. In 2006, they enacted Part D prescription drug benefit to add that to the program and the benefits. So how do you go about enrolling in Medicare? You actually, and this confuses a lot of people, your enrollment is actually through the Social Security Administration. They're the ones that look at that you're actively employed, that you've donated into FICA. You can do it either through the Social Security Administration, or if you're a railroad retiree, then you would do it through the Railroad Retirement Board. Once you're enrolled in Medicare, the actual administration of Medicare is then through the Centers for Medicare and Medicaid Services, or CMS. It can be automatic. You may not have to do anything. If you're already receiving a Social Security check or a railroad benefit check, then enrollment is automatic. So what will happen is 3 months before the month you turn 65, you'll get what's called an initial enrollment period package. It'll come in either at those 3 months before age 65, or if you're on disability through Social Security, at the 25th month of your disability benefits, this will come to you. It's going to include your Medicare card. So you'll start getting all kinds of ads. They try to make it look like this package. So we just request that you open these and look to make sure your Medicare card's not in there. Once you've verified that, if you want to throw away the other junk mail, that's just fine. If you're not receiving Social Security benefits, then you have to proactively enroll in Medicare. You can do that one of 3 ways. You can do it through the online at ssa.gov, which is a pretty easy way to go. You can do it at your local Social Security office. It is still, you're going to want to call this number because they are still not seeing people in person. They are doing everything over the phone, but they will set up an appointment for you. And then if you're a railroad retiree, then you would do it through the Railroad Retirement Board. And that's the phone number you see down below. So when do you go about enrolling in Medicare? You're going to hear this term initial enrollment period multiple times. It lasts for 7 months, and that covers the 3 months prior to the month you turn 65 through 3 months after the month you turn 65. There are some other times you can enroll, but you might end up paying a penalty if you delay, and we'll talk about that as we go through the presentation. Your preference, if you would like this to start the first day of the month that you turn 65, then you're going to want to go ahead and enroll in those 3 months prior to the month you turn 65. Doesn't matter what day of the month you are turning 65, it starts on the first day of that birthday month. Unless you were born on the first of the month, then it actually kicks in a month earlier. So you'll see by the chart, if you wait to do your enrollment, then, to the month you turn 65 or later, you're going to have a delay in when your coverage will start. So let's talk about Medicare and what it does include. So there are 4 parts to Medicare. Part A is hospital insurance. So that's when you're actually admitted to a hospital. So it's inpatient hospital care. It can also be a rehab center, a skilled nursing facility you get sent to from the hospital. And there is some home health care covered under Part A, and hospice care falls under Part A. Think of everything else except your drugs as falling under Part B, medical insurance. That includes doctor's visits, labs, x-rays, durable medical equipment such as wheelchairs, even things like dialysis and outpatient chemotherapy. Also, that is where mental health care falls. So that's all Part B. Part D is actually your prescription drug coverage. So that is just dealing with drugs. And Part C is an alternative way of receiving your Medicare Advantage plans. That actually includes Part A, B, and in most cases, Part D coverage. Medicare is also very interested in you keeping your health in good shape. So they have a whole series of preventative services that are provided at no cost from doctors who accept Medicare assignment. And you'll see pages 30 through 51 in the Medicare and You book, which you probably have already received, but if not, we can send you one from the office for a complete list of preventative services. It is also online, so you can look at it online if you prefer to review the book that way. So there are 2 ways you can take your Medicare. We're going to talk about the left-hand side of this chart and then the right-hand side of this chart. You'll notice the word or. You can be on one side or the other, you don't cross over between the 2 pieces. So original Medicare, many of our folks take because it is a fairly defined, consistent flow of your medical costs. So we're going to talk about how that works as we go through the next couple charts. Medicare Advantage plan has some things you cannot get under original Medicare, like some coverage for vision and dental and hearing, but it also can vary more in cost. So your first decision is, do you go ahead as you're enrolling and sign up for Part A? If you've worked 40 quarters or more, or your spouse has, and paid into FICA, then it's premium free. So for most people, Part A is premium free. For some others, you could choose to pay for it under certain conditions, but it's relatively expensive. You're going to contact Social Security to sign up. And the main reason people would not sign up for Part A is if they are still actively employed and they have a health savings account that they would like to continue to contribute to. Once you have either Part A or Part B, you cannot contribute to an HSA tax-free. You can use the funds that are in there, but if you continue to contribute to it, you would have a tax penalty. The next question is, should you keep or sign up for Part B? For many people, if they're still active employed, or if you're covered under your spouse's active employment, you may want to delay Part B for a number of reasons. If you don't have medical coverage from active employment, you probably do want to enroll. So there's some people that want to look at it and do a little further assessment, in particular folks like retired federal employees who have other options. But delaying Part B can result in some higher premiums, and it can also result in a penalty. So you need to check, number one, with your HR department. There's no penalty if you enroll within 8 months of losing coverage through active employment. But just to make it clear, coverage based on current employment does not include if you're under COBRA, retiree plans, VA coverage, or an individual health coverage, like through the health insurance marketplace. If you would delay your Medicare coverage for any of these reasons and not enroll in the allotted time frame, you may be charged a penalty. So, how does your insurance work with Medicare? So, if you're in retiree insurance, Medicare is going to pay first. If you're 65 or older, but you are with a group health plan with your current or your spouse's current employment, and the employer has less than 20 employees. I'm sorry, if they have more than 20 employees, your group health plan is going to pay first if you're still actively employed. If they have less than 20 employees, then Medicare is going to pay first and your group health plan becomes secondary, even though you're still actively employed. If you're under 65 and have a disability, but you still have current active employment, and that employer has more than 100 or more employees, then the group health plan is going to be first. And in the other condition, if they have less than 100 employees, then Medicare is going to pay first. So ESR, end-stage renal disease, ESRD, is a little different. What happens is there's still active employment. Your group health plan is going to pay for the first 30 months after you become eligible to enroll in Medicare. After that, Medicare will pay first after that first 30 months. If you have Medicaid, then Medicare pays first and Medicaid is your secondary. So the question is, should you keep or sign up for Part B? Sometimes you have to have Part B. If you want to buy a Medigap policy, if you want to join a Medicare Advantage plan, if you're eligible for TRICARE, or if your employer coverage requires it, in all of those cases, you have to have both Part A and B. That's why we say you need to check with your HR, with your company, to make sure whether they require you to take Part A and B. If you only use veterans healthcare benefits, you may not want Part B, because veterans benefits, you can use the veterans benefits or you can use Medicare. You can't use them both on the same service. So many people that have veterans healthcare benefits might go ahead and take Part A and B and then use veterans healthcare for some of their certain types of surgeries or for their more expensive drugs, that type of thing. So if you don't sign up for Part B when you're first eligible, then you could have a late enrollment penalty for that. So when can you enroll in Part B? You can do it during that first 7-month initial enrollment period. You can do it within 8 months of retiring from active employment. Most people don't do that because they want it to kick in as soon as they don't have active employment coverage. If you do not enroll in one of those two periods, then the only time you can enroll in Part B is in what they call general enrollment. And that is from January 1st through March 31st. And your coverage in that year will not begin until July 1st. You also would then incur a 10% penalty. So 10% of the premium for each 12 months you were eligible for Part B and did not take it. So now you've done your enrollment. If you get it because you're already on Social Security, if you get it automatically, it's going to come showing that you have Part A and B. So if you want to refuse Part B, you want to make sure you follow the instructions that come with it, and you want to return that card. They will then reissue you a new card that just shows you having Part A. The card, you'll notice, has a bunch of letters and numbers on it now. It used to be your Social Security number, and one of the ways that you're fighting fraud is to eliminate your Social Security number and give you a unique number for Medicare. So let's look at what your costs look like and your premiums, et cetera, under Original Medicare. If you have Part A, and as we said before, that's going to be premium free for most people. If you were to be admitted to the hospital, not under observation, but just admitted, then you would be responsible for $1,484. And that's before they cover anything in the hospital. Then you would have a coinsurance, but you have 60 days worth of hospitalization coverage after that 1484. After those 60 days of hospitalization, then you would start paying a coinsurance of $371 per day for the next 30 days. And once in your lifetime, within a benefit period, once in your lifetime, if you needed more than those 90 days of hospitalization, then you would actually pay a higher coinsurance and you start using 60 lifetime reserve days. So that would be typically somebody that would be, might be in a drug-induced coma, that type of thing. So we don't run into it too often, fortunately. So if you've been admitted to that hospital for at least 3 full days, not counting the day you are discharged, and you needed to go to a rehab center, then you would go to a skilled nursing facility and have 20 days of coverage. And after that, then you would start paying a coinsurance for the next to up to another 80 days. So this would be true within a benefit period for everything but the lifetime reserve days. The benefit period is defined by the last time that you got out of that either hospital or skilled nursing facility. If 60 calendar days have gone by, then you would go into a new benefit period. And this cycle starts all over again. You'd be responsible for the 1484 again. Your days of hospitalization, that count starts all over again. So I'm going to give you a couple examples to make this clear. So your 60 days of hospitalization do not have to be in a row. You might be in for 10 days, out for 30, back in for 10, out for 10, back in for 10. You're still in the same benefit period, and you're still using those 60 days of hospitalization that you are, eligible for. If, on the other hand, you went in, say, in January, stayed in for 10 days and came out, and you did not go back to hospital or rehab center for another, until, say, April, so more than 60 days out, then what happens is you start that whole new benefit period. So in that case, you would be responsible for the 1484 again and start the new count of days. The other thing to be aware of, if you are under observation or in an emergency room, they are required within 24 hours to tell you whether you've been admitted or under observation. Anytime you're under observation, even if you get moved up to a hospital room, that is not being admitted. Now, the plus of that is you don't have that 1484 fee because it falls under Part B. The negative is, if you then had to go somewhere else without actually being admitted and didn't get to stay at least 3 full days of admission, then, that could work to your disadvantage. But for most people, that's a plus. So let's switch to medical insurance. Again, this is your labs, your doctors, x-rays, cancer treatments, all of those types of things. Part B medical insurance does run under an annual basis. So for most people, they are going to pay $148.50 per month. If you're taking Social Security already, that'll come right off the top of your check or your deposit. If you're not yet taking Social Security, you will get a quarterly bill for 3 times that amount, and that's how you'll pay it. This can be income adjusted. And we have some charts at the end that'll show you if you make more than certain amounts, then you would pay a higher premium for Part B. There's also a Part B deductible for the year. So the first $203 you spend in that year on doctors and labs, et cetera, you are responsible for. After that, then Medicare is going to pay 80%, and you'll be responsible for 20%. That's if the doctor or facility does not accept assignment. If so, they can charge up to 15% higher. So let's talk about that. If the Medicare approved amount is $100, let's say your doctor charges $200. but the Medicare approved amount is $100. Then Medicare is going to pay that doctor $80. You're going to be responsible for the other $20 if they accept assignment. If they don't accept assignment, they still are tied to that rate of the $100, but they can actually charge up to $115. In that situation, if they don't accept assignment, Medicare is still going to pay the $80, so the 80% of the $100 rate. You're still responsible for the $20, but you're also responsible for the 15% above that, so the additional $15. So the next decision, if you're staying with original Medicare, is to decide based on those coinsurances and deductibles, do you want to add supplemental coverage? You'll hear this called supplement, Medigap, secondary. You'll hear it called all kinds of different things. But essentially, it's designed to pay against those deductibles and coinsurances. So what is it? It's first off, they're sold by private companies. They are designed to fill the gap in the deductibles and coinsurance, not a gap in services. So if it's not covered by original Medicare, if you have something done, so I'll give you an example. If you have cataract surgery, original Medicare is going to pay for that because it's medically necessary. If you decide you want to switch at the same time and have the surgery also correct astigmatism, it's not going to pay for that because that's not medically necessary. So in that situation, original Medicare is going to pay, and the Medigap will pick up the coinsurance on the base cataract surgery. It's not going to pay anything towards the additional surgery you chose to do. They do have standard plans for Medigap policies. If any plan that has the same letter is going to have the same coverage, although you'll see all different costs. So first off, do you need a Medigap policy? You may or may not. You might have other supplemental coverage. You might have a retiree as a former employee. You might have a retiree plan. You might have TRICARE. You might have Veterans Health Care and want to just use that instead. If so, you might not need a Medigap. The other part of the question is, can you afford the Medicare deductibles and copayments if you don't get a Medigap? So there are plan types here, not to be confused with Part A and Part B, but they did designate the plans with letters, as you can see across the top. If you look down the left-hand side of this chart, you'll see the coinsurances and deductibles that we talked about on the earlier chart. I'm going to talk to two of the most commonly chosen plan types, and that's G and N. If you look across where it says Medicare, if you look across the row where it says Medicare Part B deductible, $203, you will see that none of the currently offered plans for anybody that turned 65 after January 1 of 2020 will cover that deductible. So everyone pays that picks up a plan at this point. Outside of that, if there's an X in the row underneath the column, then it says that that's covered. So let's look at G. G is going to be your most expensive premiums, but it's also, as you can see, after you've paid that $203, it's going to cover all your other coinsurances and deductibles. And N is a very commonly chosen one too, because it's got a lower premium. Again, you'll still pay that first $203, but the difference to a G is that you will also pay up to $20 if you go to a doctor's visit and up to $50 if you go to the emergency room if you are not admitted. If you're admitted, you don't pay that $50. You'll also see there's a blank next to the 15% excess charges. That only impacts you if you are treated by someone who does not accept assignment and charges that extra 15%. In that situation, you would be responsible for that extra 15%. Another one that some people are considering these days is a G high deductible, because that's a much lower premium and protects you on the catastrophic side. But you'll see the footnote down to left bottom. In that situation, you're not only going to pay the $203, but if you use those other services, so if you are admitted to the hospital or if you're using the 20%, off doctor's visits, et cetera, you will pay for those out of pocket up to $23.70 on top of the $203. After that, you have all the same coverage a Plan G gives you. So it will cover all the rest of them. So that's why I say it's there for catastrophic kind of coverage. People that would consider this would be typically people who want a lower premium, but also have some money on the side, either in a 401k, 403b, whatever, that they know they have access to pay those services, those co-insurances. And they decide that I'm very healthy and I want to be able to not have to spend more on my premiums because I don't think there are many years that I'm going to use that much. Again, think about this in a 30-year horizon, though, when you're looking at it. So just food for thought on that. We're going to show you a book in a few minutes that I highly recommend you looking at to determine whether you think you want a G or an N, or any of the others you could choose. Most people that are 65 or older are not going to pick the A, B, and D. The A and D are the only ones available for people under 65 who are disabled. Therefore, their claims are higher, therefore their premiums are higher. But it doesn't mean you can't pick it. Okay, so guaranteed issue rights is a very important concept for you to understand. With guaranteed issue rights, you're able to purchase a Medigap without medical underwriting. So what does that mean? That means they can't ask you medical questions. So you have guaranteed issue rights in certain time periods. That first 6 months, you are 65 and you have picked up Part B, which is another reason some people delay Part B. So if you're 65 or older and have Part B, for 6 months, you have guaranteed issue rights. You also have them the first 6 months if you're under 65 and have Part B due to a disability or end-stage renal disease. And then you have a 63-day guaranteed issue right period after an Advantage plan or active employee group health plan ends. So that could also be retiree or COBRA coverage that pays if it pays after Medicare. Sorry, one more comment on guaranteed issue rights. Besides not being able to do medical underwriting, the other advantage to you of guaranteed issue rights is because they can't do underwriting, you're going to go in at the lowest rates possible for you at that point in time. And if you pick a plan, they have to give you that plan. And as long as you keep paying your premiums, you have that plan. You can apply for Medigap anytime the rest of your life. The negative is you will not have guaranteed issue rights. Therefore, your premiums are most likely to be higher. And secondly, they don't even have to give you that policy. So if you have one and think you want to change, do not do anything until you have the new policy. So where can you find the right Medigap policy for you? You can look at either the Medicare.gov site or the Maryland Insurance Administration site. I would highly recommend, if you're doing this online, looking at the Maryland Insurance site, because that also includes your premium. So you'll have the pricing view. Next, you have to decide if you need to add drug coverage. So for instance, if you're a VA and you believe you're going to get your prescriptions all through the VA, then, health benefits, then you wouldn't have to pick up a Part D. For most other people, unless you've got that coverage through a retiree plan that's acting as your secondary, or some of the other things we mentioned earlier, then you should be picking up a Part D. So first off, you have to have either Part A or Part B to pick up a prescription drug coverage. You have to actively enroll yourself. Obviously, we can help you with that, but nothing automatic happens on getting you into prescription drug coverage. You can delay that enrollment with no penalty if you have creditable drug coverage through you or your spouse's active employment. That's really just a mathematical equation that says the drug coverage you have is equal to or better than what Medicare has. You should be getting a letter every single year from your drug plan notifying you if your drug coverage is creditable or not. Hold on to those letters. So when can you enroll in a Part D plan? Again, back to your 7-month initial enrollment period, the 3 months before through the 3 months after the month you turn 65. You can also do it during each year's open enrollment period, and that is October 15th through December 7th. If you sign up during open enrollment each year, which we highly recommend you look at it every year, then your coverage will begin January 1 of the following year. Any other time you sign up for a drug plan, then it's going to kick in the first of the following month. If you lose employer or retiree creditable coverage, you have 63 days without a penalty to be able to sign up for a drug plan. Otherwise, you will have a late enrollment penalty of 1% of the base for each month you didn't have Part D when you were eligible. And by the way, you pay that for the rest of your life, so you really don't want to be doing that. Creditable prescription drug coverage. Some of these we can list right here, which is all the ones you see on this list do have creditable prescription drug coverage. Again, keep the letter that you get each year in case you need to prove that you've had that. You may or may not need to do that, but at least then you have it. So what are you going to pay for Part D prescription drug plan? There are 3 ways the companies get their income. And again, these are all private companies. You pay a monthly premium. And again, that could be income adjusted or apply a penalty depending on when you got into your prescription drug plan. There is a yearly deductible, and that can be this year, it can be up to $445. And it gets applied differently depending on the drugs you're on. So typically, if you're only on tier 1 drugs, which would be your preferred generics, you might not even be affected by that deductible. But if you're on specialty drugs or tier 3 or 4, then they're going to be applying that. And each company has discretion as to how they apply that deductible. And then you're going to pay an amount when you go to the drugstore. So that's your copayment or coinsurance. You want to stick with preferred pharmacies because they're going to be less expensive for you. There's also a donut hole. It is not as big a deal as it used to be, and I won't spend a lot of time on this. The total drug cost is not what you've paid for the drug, but the total cost of what the company, your prescription drug plan's paying for, Medicare, and you. That gets added up. And so people that are on very expensive drugs, they are going to fall into this. The great majority of you will not probably fall into this. But as soon as you've filled your drugs enough that it gets to $4,130 in the drug cost, then you pay 25% for the brand name and or generic. That's your cost during the donut hole. That may be more, and occasionally it's less than what you've been paying. There's another area that's called catastrophic coverage, and that's a whole different calculation. But if you're in catastrophic coverage, you're going to pay either 5% or for a brand name $9.20 and for a generic $3.70. So what's the best plan for you? So there are things to look at. What preferred pharmacies, and is that where you want to go? What are the formularies for that? Because each company defines its formulary, meaning whether it even covers that drug. So they have to cover certain classes of drugs, but they don't have to cover your specific drug necessarily. Pre-authorizations just say your doctor would have to work with your plan to get it pre-authorized for you. And then step therapy says they might ask you to do a generic first before switching you to a brand if for some reason the generic doesn't work. Again, those are all handled through your doctor, but they are things you want to look at when you look at the plan. So there's an excellent system out there on www.medicare.gov that has a Medicare plan finder. That's where you can compare and enroll in your Part Ds. You can call the plan directly, but I don't know why anybody would do that, frankly, because it doesn't give you the comparison. It makes you do all the legwork then. You can call Central Medicare and they can run this comparison for you, or you can call us and we can run it for you and we can walk you through why one plan might be better than the other for you. So open enrollment, again, October 15th through December 7th. We highly recommend you look at it every single year. And that's because your plans change, the prescriptions change. The two things you would normally compare, not the Medigap, because that again is on a different cycle. You kind of usually are making more of a lifetime decision on that. On these, you should review them every year and could change every year should you want to on both your prescription drug plan as well as your Medicare Advantage plan, because again, these change. And then the new plans do become effective January 1 of the following year. So that's original Medicare. Just a recap. The reason so many of our citizens are on original Medicare is because they know they're going to pay their premium for Part B. For most, it's $148.50 a month. If they choose to do a supplemental, they know what that premium is going to be. And then if they need drug coverage, we can run that comparison for them and they know what those costs are going to be. So on a fixed income, that can, depending on the Medigap you pick, that could be your backup to cover those coinsurances and deductibles. So it can be pretty predictable what you're going to spend in a year. On the other hand, you might spend less over under a Medicare Advantage plan. So Medicare Advantage plan is going to be more like many of your employee coverage plans. They can be either an HMO or PPO. If you this says you're going to have a network of doctors and facilities. If you go outside that network of doctors or facilities in an HMO, you are going to pay all the costs. You have no coverage. If you pick a PPO and go outside that network, you'll have coverage, but you'll pay a higher percentage of the cost, either a percentage or a set fee. Almost all the Medicare Advantage plans include Part A, Part B, and Part D. They're all going to include Part A and B. Most will include Part D. Just a reminder, if you are on the right-hand side of this chart, you may not pick up a Medicare Supplement plan. You can't pick up that Medigap to back up what your copays and deductibles are. So the next decision really is, maybe I want to consider Medicare Advantage plan versus original Medicare. So if you want to do that, you still have to have Part A and Part B. You will still pay your Part B premium, that $148.50 a month. You will also pay a monthly plan premium. They may require, and in most cases do require, to use a network or obtain a referral to see a specialist. And you will have co-payments and co-insurance, just like we had some under original Medicare. They may, however, include some benefits that you can't get under original Medicare. And that's your standard checkups for things like dental, vision, hearing aids, that kind of thing. These are the plans that we have currently in 2021. This could change for 2022. We usually get a few changes. And these are the ones that are available to you in 2021. As you can see, there's some HMOs, some PPOs, and there's also something called an MSA plan. We will be spending a lot more time on this next week in Part 2. The Care First Blue Cross Blue Shield Medicare Advantage plan is only available if you are on Quimby, which is essentially the equivalent of being on Medicaid. So it's full benefit dual eligible folks. They're the only ones that can sign up for that particular plan. So when are you able to enroll in an MA plan? You can do it again during your 7-month initial enrollment period. You can do it each year with the open enrollment period of October 15th through December 7th. In that situation, it won't start till January the following year. And there are a couple special enrollment periods where you might be able to join. So this is a pretty busy chart, but and I'm not going to spend time on it. It's one for you to sort of have as an access. And as we talk next week about the Medicare, Medigap versus Medicare Advantage plans, you may have some questions based on what you read on this chart. There is a My Medicare account, not to be confused. When you go in to sign up for Social Security, if you haven't done it earlier, they will normally ask you, you don't have to, but for most people, you set up a Social Security account that's your personal one. That allows you to go online and be able to look at your benefits, any questions you have about an appeal or, things like that, or also be able to sign up for getting your Social Security benefits. This is a different, not to be confused with that, there's something called a My Medicare account. This is all about your Medicare, and you can't create an account or log into one until you have a Medicare number. So, but once you have that, you can do an incredible amount of stuff online. And this you'll see in the bottom left, that's where you can look for health and drug plans, even if you don't yet have an account. So, but normally you would go in, save your information under your My Medicare account, and we can help you set that up. These are all the kinds of things you're able to do out there. For people like me who hate a lot of paperwork, one of the nicest benefits, besides being able to do your drug comparison every year, is you can get your Medicare claims view, the Medicare summary notices, which are lots and lots of paper. You can have them online and look at them there, and then you don't have to have those file cabinets full of paper. So I highly recommend it for anybody, as you join Medicare, go ahead and set up a My Medicare account. It also will then save your information for doing the next go round on your drug comparison. This is just listing a few of the things that are new to Medicare in 2021. This is in your Medicare and You book. So again, if you don't have one, we can send you one, or you can stop by the office and pick it up. So first off, obviously, all the things going on around coronavirus, it's paying for those costs. A nice benefit change this year was that they looked at what people were spending on insulin, and they've actually made negotiations with some of the drug plans to be able to put you in those particular plans and save a lot of money on your insulin costs, on certain insulin. It's not on all of them, but on certain ones. So another thing that's interesting is, for the first time, if you have end-stage renal disease, you could choose a Medicare Advantage plan. You were not able to do that before if you had end-stage renal disease. And a little bit of acupuncture coverage, and that's specific things for certain types of back pain. They definitely expanded the telehealth and other virtual kinds of services. So, there's a lot of benefits that, it's good to be aware of if you're just talking to your friend and finding out what you need to know about Medicare. Read the information. Also, we certainly encourage you getting a flu shot each year. That's covered by Medicare if you haven't done, where there's not a charge from the doctor specifically. And you're going to protect your health, but secondly, obviously, we want you to be getting your COVID vaccinations as well. Some people will qualify for what's called a Medicare Savings Program. So to read this chart, this is telling you, if you go down the left-hand side, the different types of programs are available. If you go across the chart, it's showing you, depending on how you file your income tax, and also an asset test. So it's going to be different for individuals than married folks. If you qualify for the first three, you're qualifying underneath a federal program. Those federal programs do have an asset test. If you were to qualify for Quimby, then you're going to look very much like Medicaid. So your Part A and Part B premiums and your other cost sharing are going to be covered. If you qualify for SlimB, so as you can see, it's got a little higher income limit and it's got the same asset test as Quimby, then it's not going to help you on those co-insurances, but it will cover your Part B premium. If you qualify for Quimby or SlimB, then you automatically qualify for Social Security Extra Help. That's designed to help you with your prescription drug side of things. So the prescription drug plan premiums, deductibles, and copays. Again, you might qualify for extra help, partial extra help, at the higher limits than you do even if you don't qualify for Quimby or SlimB. So the way to think about income versus asset. If you're collecting Social Security and a pension, you're going to add all those things together for you and your spouse if you're married. Then that amount is what you would compare for the income limit. It's at your gross level. Your asset test, let's say you've got a 401k or a 403b. Those assets would be counted into your asset test. So would second real estate, etc. Not your primary home, not a car, not your car, not a burial plot kind of cost. But all the rest would count into your asset test. So in order to qualify for the federal assistance programs, you have to pass both the income and the asset. If you've got a 401k and the money's sitting there and you're not taking a distribution yet, that's only counting in your asset. As soon as you start taking distributions, those distributions count towards your income limit as well. There is one program, though, that is state-run that does not have an asset tax. And as you'll see, it's also got significantly higher income limits. So we have quite a few people on the Senior Prescription Drug Assistance Program. You'll hear us call it SPEEDAP. No asset test. What that will do for you is pay up to $50 towards your monthly premium. So if you're a married couple, each of you will apply for that. That could be up to $100 value per month if you are, if your premium's that expensive. It also allows you to switch one more time your plan during the year. If, say, you got a very expensive drug and it's not on the formulary on the plan you're on, you could switch to another plan during the year because you're eligible for SPEEDAP. We are also considered the Senior Medicare Patrol. And this is really all about trying to detect and prevent and prosecute for Medicare fraud. So first thing you want to do is you want to protect yourself from Medicare fraud and abuse. And that really, the first thing you need to do is think about your Medicare card like a credit card. Don't leave it laying around. Don't be giving out your Medicare number. You want to watch out for that identity theft. You also want to be aware that Medicare is not going to call you or visit you to sell you anything. So the only times they will call you will be, for instance, if you've put an appeal in about something and they have all that information, then they don't need to ask you your Medicare number. If you've called the central number and it says you have a 2-hour wait, would you like us to call you back? In both cases, you've initiated it and they are then contacting you to get in touch with them or calling you back because you said you wanted that. In any other situation, if you get a cold call or somebody showing up your door and they want to talk to you about your Medicare coverage, you can assume it's fraud. You should hang up. You should not talk to them. You definitely don't want to give out your Medicare number. So you're only going to give that Medicare number to your doctor or other Medicare provider. Or for instance, if you're talking to Central Medicare or you come into a visit with us, we will need that Medicare number to be able to access your information to look at things for you. But outside of that, you shouldn't be giving that Medicare number out. So the best way, you're the first line of defense to determine if there's Medicare fraud going on. And that's really by reviewing your Medicare summary notices that you get. So any other statements, et cetera, that you get from Medicare, you should review them and make sure that the services listed are things you had done. You can also check for double billing. Sometimes you'll see something and say, wow, I think that showed up that I've already paid for that, that Medicare's already paid for that. You can also check to see if there are any services that were not ordered by your doctor. It gets a little more challenging on hospital visits. But again, if somebody else is in there with you most of the time and all, they may be able to answer that question for you. But so review for all of those types of things. If you see a problem, the first thing you should do is call the provider, because in some cases, somebody's just typed a number in wrong. And that may get cleared up, and then the provider can, contact Medicare and, get it backed out. They would refund to Medicare whatever was paid to them. If that doesn't appear to be the case, then you just want to make sure you have your information and documentation handy. And then you contact SMP or Medicare Patrol. And then that is a free and confidential service. You can do it either through SHIP, you can do it through the central number at Medicare. And either one of us can help you with it. And that's confidential service. You do not have to worry about, your name being given back to somebody, et cetera, et cetera. So, but we'll determine with Central Medicare actually does the investigation, but we can take your information and initiate the call into Medicare to help, explain what's going on if you want us to. So again, we're both the State Health Insurance Assistance Program, or SHIP, and the Senior Medicare Patrol that's local for you. You can contact us, and it's in a lot of the information that's sent along with these presentations, but you can contact us at 410-386-3800. That's going to get your desk, the front desk at the Bureau of Aging for Carroll County. They will then either connect you directly with Nicole Renewal, who is the coordinator for SHIP and SMP for Carroll County. And you could dial her directly at 410-386-3806. At both of those numbers, they can set up appointments, answer questions for you. They can send out the information that you might want mailed to you, or put together a package you can come pick up at the office. Everyone except Nicole that works there are volunteers. You noticed up front we said train. So we not only have to go through the training to be able to do this to help you, but we also have to take tests to show that we know what we're talking about. But this is free local help for people with Medicare. So, please take advantage of it. I'm sure you have questions, by the way. Aren't able to ask it in this venue, but you can call us and ask questions. The next two charts, all this is saying that if you make more than a certain amount of money for both Part B and the next chart, Part D, you will pay a higher premium for your coverage. So if you, as a married couple, file a joint return and make more than $176,000, you will pay more than the $148.50 per month, each you and your spouse will. So you'll see if you file separate tax returns, they really actually scale you up very quickly to a much higher amount. But if you file jointly, you'll see the categories there. You could pay if you make significantly, so above $750,000, or above $500,000 if you're an individual, then you would pay $504.90 a month versus the $148.50. So again, some people that are still working would be hit by this more likely than the folks who, have retired typically. This is based on your yearly income in 2019 for what you would pay in 2021. And Part D, same thing. If it's above certain amounts, you're going to pay your planned premium. But if you make more than those certain amounts, then you could pay up to as high as $77.10 above your plan premium. So you'd play, in this case, you'd pay the plan premium plus that amount. Thank you for your attention. We look forward to getting to interact with you, but it's a pleasure being able to present to you. Have a great day.